Well, this program got started as a result of the National Lung Cancer Screening Trial that happened a couple of years ago. That was a controlled trial of over 50,000 patients where the population was studied with screening for lung cancer using regular chest x-ray versus screening with CT scanning. And what they determined was that there was a 20% mortality decrease by screening with low-dose CT scanning in order to find lung nodules early and allow their diagnosis and definitive cure with an operative procedure or other treatment. What we're looking for when we talk about lung nodules is a small spot or a little growth inside the lung parenchyma itself, so within the lung in your chest. Typically that can be caused most commonly by benign things like prior infections, where we form something called a granuloma. On people with the right risk factors, though, when those appear out of nowhere, one of the concerns that we have is that they're a very early lung cancer. And so what we're looking for when we say a nodule is something between the size of a piece of unpopped popcorn all the way up to a pea, a very small little dot within the lung. We want to find those when they first develop, and if they change in size, meaning get any bigger over a short enough period of time, then our goal is to go sample that tissue or remove it in order to catch lung cancer early before it becomes an incurable disease. Well, lung cancer has always been a difficult disease to cure because in most cases when it's discovered in a patient, it's already well advanced, meaning it's spread away from the original nodule that existed in their lung into the rest of their chest or elsewhere in their body. And that's what makes the mortality higher, is because typically it's been very difficult to find it early, and once you do find it, it's already spread to other parts of the body beyond the point where it can just be removed and cured. And so the purpose of doing a screening program is to try to catch these nodules when they're very early in their presentation, before those cells have spread anywhere else in the body, and so we can remove the tumor itself. The disease is completely gone from the patient, and therefore they're cured from the disease. Well, the screening is a straightforward process. First, we ask some questions of the patient to make sure that they fulfill the criteria of a person that would need to be screened. For example, an otherwise healthy 25-year-old individual that has no risk factors, has never smoked, is really not the kind of patient that we're concerned about screening. We're concerned about finding patients that have high risk factors, and right now today those risk factors include an extensive history of smoking, or a slightly smaller risk of smoking with other kinds of exposures, say to uranium mining or certain other occupational exposures. That's the first part. So first we identify whether or not a patient may be a candidate. Once we determine that the patient's a candidate for screening, the procedure itself is simple. We don't require any kind of preparation. There's no IVs or needle sticks or anything else. It's merely a CT scan using the kind of machine that you see here behind me, whereby the patient lays on a table. The scan takes approximately 20 to 30 seconds, and that allows us to acquire data or pictures through the entire body from just below the bottom of their diaphragm all the way up to the top of their lungs, and image their entire lung parenchyma that way. So the screening test is non-invasive, it's very simple. It takes about 30 seconds from when you're on the table actually getting the scan done. Probably one of the more important parts is the interview process ahead of time, just to make sure that the right people with the right risk factors are the ones that we're looking at. The folks that we're interested in screening are basically fall into two categories. One are people with a long smoking history, ages 55 to 74, that have what we call a 30-pack year history of smoking. A pack year is defined as a year of smoking 1 pack a day. So that could be a pack a day for 30 years. It could be 2 packs a day for 15 years. Or if you're a really heavy smoker, 3 packs a day for 10 years, and hopefully nobody listening to this would smoke that much. There's another category where people may be exposed to certain occupational risk factors, such as certain activities in mining and other things, but would still have a smoking history, but of a 20-pack year history of smoking at a slightly young age of 50 and beyond, as opposed to 55 and beyond. So in general, if you're a smoker and you have a significant smoking history, you're over the age of 50, it's worth a phone call to find out whether or not you may be a candidate to have a screening performed. We have arranged this as a comprehensive program. So if a patient does not have a physician in town, we'll arrange a referral to a pulmonologist or another provider, both for counseling in terms of smoking cessation and other things like that related to people that are for high risk, If for whatever reason we do find a lung nodule, that's going to require some other medical attention and follow-up studies in order to assess whether or not it changes in size. If it's a certain size, when we first scan the patient, they may need to actually seek a surgical consultation. And that's one of the advantages of the program we've established. We have a group of providers that are involved. It's not only an imaging test, we're also working with the pulmonologist and also other diagnosticians in the surgical services here in town, so that a patient that comes to get screened can deal with the results regardless of whether they're negative or positive, and seek counseling for the things that gave them risk factors to begin with.